Hello, how are you doing today?
I'm doing just fine.
I'm Gina. I'll be your nurse today. I'm going to do a head to toe assessment on you if that's okay.
Okay.
Okay, so I'm going to go wash my hands, put my gloves on. I'll be right back.
Okay.
So I wash my hands and I put my gloves on. Now I got a few questions to ask you. Okay, so could you tell me your name?
Marquez
Could you tell me where you are?
at the doctor's office.
And do you know why you're here?
Annual checkup.
Okay, and one more question. Could you tell me who the President of the United States is?
Yeah, Joe Biden.
Okay, so I would say that my patient is awake, alert, and or 10 times 4. Okay, so before we start the head to toe assessment, I'm going to check your blood pressure.
Okay.
Do you have any arm that you would prefer me to check?
It doesn't matter.
Okay. Sorry. Okay, Ms. Marquez, your blood pressure is 120 over 75. Do you know what your blood pressure range is?
No.
Okay, so I'm going to start from your scalp all the way to the bottom, okay?
Okay.
Okay, so I'm checking your scalp for any abrasions, lesions, parasites, alopecia. I don't see any. And then I'm going to check your ears for any drainage, lesions, abrasions. I don't see any, and your ears are symmetrical. Now I'm going to check your eyes, and I'm going to ask you to follow my pen light. Follow it with your eyes and not your head, okay? Okay, now I'm going to put the pen light in your eyes just for a quick second. Okay, could you do this for me? Okay, so my patient's pupils are equally round, reactive to light, and they are a size 2. Your sclera is white, your conjunctive is clear, and I see no signs of jaundice, and I see with your conjunctive, I see no redness. Okay, so now I'm going to do your nose. I'm going to ask you to raise your head back for me. Okay, so your spectrum is midline, your nares are patent, and your nasal mucosa is pink, moist, and intact. Now I'm going to ask you to open your mouth for me and stick out your tongue if you could. Okay. So I would say that your oral mucosa is pink, moist, intact. Your uvula is midline, and your tonsils are free from drainage or
Okay.
swelling. Okay, so now I'm going to check your carotid pulse. Okay, so your carotid pulse bilaterally is a 2+ strong. Actually, can you do this for me? Okay, your trachea is midline. Now I'm going to inspect your shoulders, if that's okay. So I'm inspecting it. Do you have any pain in your shoulders?
No, ma'am.
Okay, so now I'm going to palpate and touch you. Okay, I'm going to feel any swelling. Now I'm going to ask you to do a few range of motions with me if you could.
Okay.
Okay, could you raise your arms like this? Drop, and then like this. And then like this. Now I'm going to ask you to try to push my hands all the way down if you could. Good job. Now up and try to do it. Good job. And can you squeeze my fingers as tight as you can? Okay. So I would say that my patient's range of motion is full range of motions in the upper area. Now I'm going to check your brachial pulse.
Okay.
Okay, so I would say bilaterally your brachial pulse is a 2+ strong. Now I'm going to check your radial pulse with your hands. Okay, bilaterally your brachial pulse is a 2+ strong. And now I'm going to check your nails and your fingers, checking for any abrasions, lesions. Now I'm going to check your capillary refill time. Less than 2 seconds. And then I'm going to check your nail beds. Your nail beds are pink. Okay. Now I'm going to check your heart sounds.
Okay.
Back just a little bit. Okay. I'm checking your aortic first. And then I'm going to check your pulmonic. Now I'm checking your tricuspid. And now I'm going to check your mitral and apical pulse for a full minute. Starting now. Okay, so your S1 and S2 are heard. I hear no adventitious sounds, and your apical pulse is 56 beats per minute. Okay, so now I'm going to check your lung sounds. Breathe in. Breathe out. Breathe in. Breathe out. Okay. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Okay. One more time. Breathe in. Breathe out. Good job. Okay, so bilaterally your lung sounds are heard and clear. I hear no wheezing or crackles. Okay, so now, before I ask you to lay down, I'm gonna check your back. We'll check your back, and I'm checking your back for any pressure or series, breakdown, scrapes. I don't see any. Now I'm gonna ask you to, could you lay down? And,
I'm gonna lay down flat.
yes, please. And I'm checking. I'm gonna inspect your abdomen, making sure that everything is flat before I palpate. Okay, now I'm going to check your bowel signs. Okay, so I would say that my patient bowel signs are active times 4. And then I would check your femoral pulse. And then I would check your perineal and perianal for any abrasions, lesions, or bruising. And after that, I would check your buttock area to make sure that there weren't any breakdown or lesions, abrasions. And after that, I would, I'm going to ask you, can I palpate your thigh area?
Yes, ma'am.
Okay. Do you feel any pain?
No, ma'am.
Okay, no pain, and I don't feel any, see any bruising. Okay, now I'm going to check your popliteal pulse.
Okay.
Okay, so I would say that your popliteal pulse are bilaterally 2+ strong. And now I'm going to palpate your lower leg area. Do you feel any pain?
No, ma'am.
Okay, I feel no swelling. I'm going to push my foot down. Okay. Now I'm going to check your posterior tibialis. Okay, so I would say that that's a 2+ strong bilaterally. And now I'm going to check your dorsal tibialis. Okay, it is strong bilaterally 2+. Oh, sorry. Now I would check your nail beds and your toes, and I'm checking for any abrasions, lesions, and I don't see any. And I would check your capillary refills. Your capillary refill time will be less than 2 seconds, and your nail beds are pink. Now I'm going to ask you to do a few range of motions with me in the lower area.
Okay.
Okay, so I'm going to ask you to try to raise my hands up. Good job. Now, try to raise them back. Good job. And could you try to raise your legs up? Good job. So I would say that you have full range of motions in the lower area as well.
Okay.
Okay, and that would be the end of my head to toe assessment.
Thank you.